Welcome back to our second session of pregnancy and infant loss awareness. And Grace, we have talked about infant loss in depth and you have shared your story. But I feel we also need to touch on pregnancy loss now coming from a professional point of view because I know you are a professional. Um, Pregnancy loss is also not easy. It's another kind of grief and pain that we really minimize. Unfortunately, sometimes it is minimized from the partner level, the parents who had conceived the child. And I know it can be tough. And it has all these sorts of, effects, anxieties, and especially on the mother at times, because it's the mother who carries the pregnancy. What can you tell us about this experience?
So when you're talking to women who have miscarried, they'll tell you that the way people just assume it was like a period, the way people told you that it was not even a child. And, there is nothing that is hurting like when someone minimizes what you're going through. And it's very good to listen to other people's pain, to sit and just listen. Don't even start telling them that it is not that bad, you can just listen. If they tell you that I feel so awful, tell them I understand where you're coming. Because of course, even if it happened to you, you'd feel bad. And they'll tell you that people tell them, you can just get another one. You know those
Blushing off statements.
They just sweep that thing under the rug. It's like they don't even want to listen to it. And you'll find most people will even undergo miscarriages and they keep quiet. There are people who have undergone multiple, not one, not two, not three, and they just keep quiet. And then when they pile up those things, eventually they're not in a good state of mind. And the ones maybe who are supposed to give you support, they don't. But I like the fact that there are some support groups that are there when you look for them. At least they listen to you. You have a safe space where you can share with people who have undergone experiences like you. You encourage each other. But I'd like to tell people that even that is a loss. Just because something to you does not seem as a loss, and to me it is a loss, you don't have to minimize my loss so that you can feel okay. That's actually quite unfair. It's very good to understand that all of us are different. There is someone who is going to grieve for that miscarriage in a deep way, and it's good that they are given a space to do that, a space where they are comfortable, because when we sit with our emotions, I think that is where the healing starts. But when we shame them, when we ask them, Kwani, what did you do? Kwanza, there is that misconception that when you miscarry, you must have done something, ama you are trying to abort. We have to be empathetic as we deal with some of these things. I think that if we provide safe spaces for these people, it would be better. And I think that is why there is that awareness that you talked about. The awareness month is to break some of the stigma, to create awareness, to educate people on some of these things so that we can learn, so that the next time maybe you have someone who is undergoing that, you can do a better job because you know the facts, you know the myths, you know the misconceptions, so you can come from a good point as you relate to these people. Yeah.
You've said something very profound that we should be humane enough and stop minimizing people's pain and give people safe spaces. I know, especially pregnancy loss, it has brought even, differences at even a family level. sometimes even a man might end up thinking this one was intentional about terminating this pregnancy. Whereas maybe it innocently, of course, we acknowledge there are bad people who will do that, but there are people who are, you know, who have gone through this, not in line with what they have wanted. What what can we tell these spouses?
I think that one of the things that we forget is that children are gifts from God, and we do not give ourselves children. I think when we remember that, we'll be even kind to these people, because there are people who actually don't have children and they want them. And actually, what you said about from the family aspect, there are even people who, there are families which break because of things like that, miscarriages, child loss. You'll hear someone saying that they were divorced because of that. And I think we have to remember that some of these things do not belong to us as humans. There are things that are just beyond us. And I think even when we look even at scripture, there are people who lacked children. And I think it's when we understand that it's deeper than us, it's deeper than just wanting a child and getting a child, we would be, I think we would be more kind to these people. But actually, that is a trend. That is a trend, because you even hear even ladies who cannot conceive, they'll say that they were divorced because they could not conceive. Especially in African society, we have that belief that a married couple has to have children, and sometimes we forget that we do not just get children from nowhere. It's God who blesses us with children. And I think we have to always remember that at points when we are tempted to do such things.
If we go to the corporate space, I think even at this space, pregnancy and infant loss is also minimized. As I was researching about this, I came across something very, I can say something very good that is not being practiced in many corporates. And I must applaud East African Breweries Limited, because they have formulated a policy where, if a staff experiences infant or pregnancy loss, their maternity or paternity, their maternity leave is extended to 6 months, and it's a paid leave. To me, this was very profound, because it is enough support, for this particular person, at least to start their journey of healing. And I was asking myself, why would other corporates not take up this? And especially where even somebody miscarriages. You will see somebody miscarriages, they just given sick of and absorbed back immediately. If the doctor gave you 1 month, we are just into the physical healing. But the emotional, which I feel it's what makes a person, we are not concerned. What can you say about this?
That was a good move. I also saw that, and I think more corporates should go that way, because remember, when you go back and you're not good mentally, you cannot even perform your work well. And when you recognize that, I think as you give that leave, you will know that you've given that person time. They'll have time to set their things in order, such that even when they come back, they are mentally stable, they can work. Because at the end of the day, at the corporate level, what you need is results.
Yeah.
And when people don't give you results, you're supposed to deal with that problem. I think that was a good move, and it would be good if other companies would follow that, because not all people who have miscarriages or child loss are in self-employment. We have to remember that there are those who work in corporates, and they be given that space to mourn, to grieve, to go through all the emotions, and so that when they go back, they are in a good space. But you can see, for if you're self-employed, you can do what you want. But for corporates, I think they've given a good example, and others should follow. Yeah.
Having traveled this journey, what support do you think we can accord those who've been bereaved by, bereaved by the virtue of the lost a pregnancy or the infant loss?
Mm, I have to say that when it comes to grief, everyone has their own way of grieving. And it's very good when you are dealing with a person, you ask them, because there are people who like talking about their children, they like talking about the baby they were going to have, and there is someone who does not want to talk about them. So I think when you want to help someone, you have to be able to listen to what they want. If you do not know what to do, the best thing is to ask. When you go to that person, you ask them, how can I help you? From there, that person will give you a guideline of what they need. Because I think everybody grieves differently. There is someone who will tell you, I want you to listen to my child's story. There is someone who will tell you, I want us to just keep quiet. There's someone who will tell you, I need a hug. Someone will tell you, I need to cry. But when it comes from the person who has gone through that, it will be more authentic, because you'll be doing it from their terms. And I think that would be the best advice, because we have to accept that we are different, we do things differently. So that would be my best advice. When you're going to someone, you can ask them, do you want to talk, or do we just sit and just keep quiet? Because it's good to accept what works for one person does not work for one person. Like me, I love talking about my daughter. Even now, I even have her picture. There is someone who cannot do that, and it's good to accommodate all people who are there, and to work with someone the way they need to be worked with. If they want that, you do that. If they want quiet, you just respect them. Yeah.
What about that person who has built a wall like you had done, and we are realizing, or rather we are noting, this person is not okay,
Yeah.
and we really want to support this person, because clearly these are some of the things that can lead to depression, and hence maybe even suicide. So we want to prevent all these things that can occur as a result of this. How can we be of support?
Even presence. Sometimes, even that person who is not okay, there is nothing that is as big as someone's presence. And if you have people who are present, really, really present, not just there physically, they are in tune with how you are doing, with your emotions. You have those honest people who, even when you say, I'm fine, they tell you, no, you're
We are
not
not
fine.
fine. We are not leaving you like this.
You're not okay.
We are here.
We are here. We don't care what you're going through. If you want us to sit here,
The
we'll
whole
sit
night
here.
we will sit.
If you want us to cry, we'll cry. Because we have to give people, we can't force people to do things they don't want. And I think we have to give people space and to accommodate them. And when we are there, present, physically, emotionally, psychologically, we'll just know. I'll just look at you and tell you, I fancy you're just lying to me. You're not okay. This is not you. Even your face can tell it. So don't give up. Don't say that he just keeps quiet. It's just Maybe that's the way they are coping. It might not be healthy, but that is how they feel at that time.
That's a coping
Yeah.
mechanism.
And it's good to be there, just
Mm.
there. And we remember, even when you pass through those things, you just remember there are people who used to call you and like, I'm just checking up on you. They'll not even ask you if you're fine because, of course, they know you're not fine. So they'll be like, I know you are not okay. I'm just checking up. Are you good? Yeah. So you, at the back of your mind, you'll know that you have people who
Care.
care. Yeah.
Who genuinely care.
Yeah.
Wow, this is so profound. This is so deep. And I'm emotional because sometimes it's too much to handle. And especially when you are having this conversation with somebody who has walked that journey, you know, you can feel every pain at every step. And so I want you to encourage somebody who has gone through or who is going through that season in their life, and you know, you tell them, we don't want to tell them it is okay because it is not, but we tell them they will still rise again regardless.
Yeah.
Yeah.
So, to any woman out there who's gone through pregnancy or infant loss, it's not an easy journey. Um, I've walked that journey, and even now, it does not matter how many years down the line you go, there are still days that you'll feel like that pain is so fresh. It's like it just happened, and you have to give yourself space to feel all those emotions. Be compassionate to yourself, just the way you'd be compassionate if it is someone else going through that. Practice the same. If you feel you need to look for support groups, please do that. If you feel you need to talk to someone, kindly do that. But remember that things might be hard now, but it gets better. I would not say that time heals because these are wounds that we'll always have, but there are days when you'll wake up and you'll be able to encourage someone else because you passed through that, and that is not the end. And find people to support you. I think when you have support, even if it is support groups, there are people who have pages where you can just go, you just pour your heart out, do that. If you can journal, please journal, you can write, but go through those phases and remember that some days you will feel very okay and some days you'll feel like you've never even healed. And it's good to give yourself space to feel all those emotions and to be kind to yourself as you walk that journey, because at the end of the day, it's just you, because you're the one who knows how you feel that pain. That would be my encouragement to them.
Grace, we thank you very much for finding us worthy to actually share your story, to be vulnerable to us, you know, to encourage a woman out there, even a father, a man who maybe have gone through infant and pregnancy loss and they feel devastated, they're overwhelmed, they don't know where to turn to. You know, this is such a those videos that are very close to my heart because they are pain that people can't talk about. Because for one, even if they talk, they feel they won't be understood. Their pain will be minimized.
Shame.
Shame, you know, the stigma around
Yeah.
this. And so finding you coming here to share with us, encouraging us, telling us it's not the end is just something we cannot, you know, say thank you enough times. We are really grateful, and especially even putting in even your professional wisdom in this. So, guys, I hope you have learned. I hope next time you're not going to be there minimizing somebody's pain, stigmatizing somebody, but we'll support these people as much as it takes to see them back. And back is not only physical, but even emotional, which is very crucial parts of human wellness. So don't forget to like, to comment, to share, to subscribe if you've not, and above all, to practice what you have learned. Thank you. Till next time.